Everyone hits puberty on their own schedule, but as peers pass typical milestones, the wait can become stressful, even when family members offer the well-meaning label of late bloomer. When a teenager has never experienced a menstrual cycle, doctors use the formal term primary amenorrhea. The American Society for Reproductive Medicine provides clear benchmarks for when to seek an evaluation. The first occurs at age 15 if a period hasn't started despite normal secondary sexual development. An investigation is also indicated if there is a complete absence of breast development by age 13. Finally, a checkup is recommended if 5 years pass after the initial onset of breast development without a period, even if the teen is younger than 15. Reaching these specific age thresholds serves as a clear signal to transition from waiting into active investigation. A first gynecological visit is structured as a supportive dialogue between a patient and their provider. The provider will ask about the mother's own puberty timeline to identify patterns of constitutional delay, where a later development schedule runs in the family. They will also discuss stress levels, nutrition, and participation in high-intensity athletics. These factors impact how the body manages its energy resources. In a condition called functional hypothalamic amenorrhea, the brain pauses reproductive signals in response to intense physical stress or low body weight to prioritize more immediate survival functions. This thorough medical history allows the doctor to see if the body is intentionally suppressing the menstrual cycle based on environmental or physical factors. The physical examination is performed with a focus on gentleness and the patient's comfort. This clinical roadmap illustrates the logical steps a doctor follows during the evaluation, starting with a review of developmental milestones. Observing breast development confirms that estrogen has been active within the body's systems. A non-invasive pelvic ultrasound provides a view of the internal anatomy, verifying the presence of the uterus and the state of the reproductive pathway. These tools confirm that internal structures have developed and the anatomical pathways are open. Blood tests allow the doctor to monitor the various hormones moving through the body to ensure all systems are communicating properly. Testing TSH measures thyroid function, ensuring the body's metabolic engine is balanced and providing the necessary energy for a cycle to begin. Prolactin is also checked. An elevation in this hormone can silence signals required for menstruation. Measuring FSH lets doctors monitor the primary signal traveling from the brain down to the ovaries. These laboratory results pinpoint exactly where the hormone network is failing to transmit the necessary instructions. Most underlying causes for a delayed period, such as polycystic ovary syndrome or thyroid imbalances, are common and have straightforward management plans. Following the evaluation guidelines of 13 and 15 ensures any needed support is provided early. The body is highly adaptive and is often simply waiting for the right conditions to initiate its first cycle. Scheduling an appointment is a proactive step toward aligning the body's systems and supporting